Now, just to broadly understand, what do we mean when we say health? Now, health is not all about being disease free.
Entrepreneurship in Nigeria is
It's,
very, very
as
glamorized.
according to WHO,
I
it's
feel a
a
lot, so
healthy state
it's
of your
really
mind,
difficult
your body, and your
advising people
social well
to
being.
quit their jobs and start up a business.
Now, to be considered
That's really the
healthy,
way
your mind
that
has
every
got to be
business
in a
has
good
come in
place.
life.
Your
And
body has to be fit,
that
you have to be well
if you're
nourished,
working for
and
somebody
your social
else,
interactions need
then you're chasing
to
somebody
elicit
else's
happiness.
dream. So the first
You
question
find
people
that
now ask
people are
me
in a
about
room full of people they
entrepreneurship,
call their friends,
I always
and
raise the
yet they are suffering
caveat
from depression.
that my
Those are not
definition
healthy
of
social
entrepreneurship
relationships.
is
So for you to
doing
be
something that is
to be
almost
someone who
impossible to
is
achieve
healthy,
alone.
you need to
As an
have
entrepreneur, you need
social
a very, very
interactions
good
that
team that is
cause
able
you to
to
be
execute
happy.
that vision with you. And sometimes people go into
Now, how does
entrepreneurship,
health
start a
affect
business,
wealth?
and then find out that that's
For
not for them.
entrepreneurs and business people,
Um,
wealth creation
and
and
that's where we get
sustainability is
here.
very important.
I think that there are two
The
problems
ability to
in
attain
Nigeria. One
wealth is
is, of
often
course, a
hampered
lot
by
of
poor
businesses are
health.
failing. So there's lots of
And
people who
I'm sure
are
most
doing
of you
good,
know
but they're not scaling.
productivity
They're
is
not able
low
to
when
scale.
you are
So
not
they're
feeling
probably the ones with the
optimal.
largest skill. But there's
For
also
those that
a
have
huge
people who
problem with
work for them,
executives.
some days you wake up and someone calls
Inspired,
suddenly and
talented,
says,
experienced
I'm not feeling
executives
fine.
that are
I
ready to
can't
help
come
the
to
company
work.
grow.
And you have
So
made
I think the
plans.
first
You have customers
major
that you need to
question
service.
is
You have
focus.
people who are
People
relying
need
on
to
you
make
to be able to
entrepreneurship
deliver
and being
on promises that you have
entrepreneurial
made.
in an
But
executive
because of
role.
one health
There's a
related
quote
issue
quote
or the
saying
other,
from
you're not able to
Carnage,
fulfill that, and
and
that
one of the
impacts on your
statistics
bottom
that he
line.
quotes in his study is that only
Now,
4%
Nigeria is
of
a very
businesses
complex environment.
in America ever
The ease
reach
of doing
$4
business in
million.
Nigeria is very poor. We
And
are
that's
ranked
the
about
greatest tax in the
146 out
environment
of
in
the
the world.
190
Only 4%
countries.
of the
It's a very
businesses
difficult place to carry out
make
business, and we appreciate
300 about
entrepreneurs for
360
being
million
brave and
naira.
bold enough to
But
try
that's the
to chart
salary of a
this
banker
course.
as an employee.
So it's very
That's the salary
easy
of
for us to
probably a
forget,
partner in
stop,
KPMG or a
and
partner
take
in any
stock
of the
about what
large
is going on with
consulting
ourselves.
firms.
Most often, we
So
are
I think
enamored
the
with
decision
all the
around
issues around
being an
meeting our
entrepreneur and a
financial
business
targets,
owner, or
getting the
being an
customer
entrepreneur,
happy. But then, what
entrepreneur in
happens to you
anything
as
that
an
is helping to
individual?
grow a business,
How many
that
times
is
do
the
you
first major
stop to
question.
take stock
And then the
of
second
how
major
exactly
question
you are
about
feeling?
innovating for
What
scale
is
is
your health
actually like
trying
what
to
does
say to
scale
you?
mean to you and do you want to reach scale?
Now,
As an
58% of the world
investor,
population
I have
spend their
speak to a
time
lot of
in the
business owners,
workplace.
and every business
What
owner
does
has a
the
different
workplace
ambition for
actually
what they
feel
think
like?
scale
Do you
means to
have an
them.
enabling
For some
environment that
people,
allows
scale
you to
just
feel
means that they
100%
can
and
pay their
to
school
operate
fees, they can
optimally?
buy a car, they can rent a house, maybe a VI,
Now, you
and
have
they
issues
can
where
spend most of
people
their
say they are
profit
not
taking care
feeling
of their
well,
expenses,
either
and that
because
is
they have
okay.
not
They don't
had
want any
or
more.
made enough
And
time
I don't
to
want
take
any
some rest
entrepreneur
for
to feel under
themselves.
pressure that you have to be
Some
addicted.
people come
Because
to
everyone
work,
is
they are
also making
present in the
sacrifices, maybe
workplace,
in other
but they are
areas of
not
his life to reach
operating
that scale.
optimally. That
So
is
it's
what we
important to
call
realize what scale
presenteeism.
means for you
They
personally
are
before you
there.
go along a
What
journey
are they
where
doing?
10 years down the line,
What
that's
they
not
have
something you
achieved
really
at
want
the
to
end
do
of
with
the
your life.
day, is that the best they
And
could
then
have
the third
provided at
thing
the
is
end of
even
that
people
day?
that want to reach scale that
What is
tell
the
you, okay,
cost to your
yes, I want
business?
to be the next Dangote, I want to be the next
Now,
Sama.
some studies have been
Sometimes
taking
the
place
interviews,
in
the
countries
speakers
like
that
the
visit them,
UK,
I
where
actually
people are
find
trying to
out
actually
um,
quantify in
that they need
financial
to
terms what
really
does
do
it cost
things that will help them to
when
reach scale.
productivity is low.
So throughout my presentation on the market
Absenteeism
size
in
in
the UK
Nigeria,
has
I
been
want to
calculated to cost
keep on going back
employees
to this
about
three
9
questions.
billion pounds. Can you
Entrepreneurship
imagine what that
as
means
sole
on your
proprietor
bottom
or
line?
business owner or entrepreneur, as
Presenteeism
an
is even
executive, giving
worse
them a valid
because they are
car.
in the office, you are
Number
paying
two,
full-time salaries,
do you
and they are
actually
not
want to reach
productive
scale? How does
or
scale
producing
look for
or
you?
acting
And number
optimally.
three,
They have not taken time to
so
look
I'm going
after
to go right in
themselves
talking about
and
the
take
market
care
in
of all those
Nigeria. The
issues
market in
that do not
Nigeria
allow
is
them to operate
fascinating to
the way
me.
they should.
And when I first went into this,
Physical
this was
health is
something that I
very
didn't quite
important.
understand.
Mental
So
health
I
is
think one of the
critical
biggest
for people to be
quotes
able
to
to
give me
do and
insight, one
achieve
of
the
the
task
biggest
that you have
reasons,
given
number
to
one
them.
reasons why startup businesses fail
Now, I work in the
is
nutrition
there's no
space.
market need for the product.
Health is the
So
language
people
that
are
we
bringing
speak.
products to the market
I
to
work for an
and that's
organization that
number
is
one
focused
reason
on
why
eliminating
businesses fail.
malnutrition
There
in all
weren't
its
enough
forms.
customers or
And
there
we
were
do
good
that using a
customers.
food
So
systems
when you
approach. We
speak
strongly
to
believe in
entrepreneurs,
you
I
are
think
what you
some of
eat.
the things that they bring up are
Now,
like
looking at
overworking, like
this
I said before, lack of
data
mentorship, they can't find good
from the
staff.
Global Burden of
But I
Disease
think the
study,
number one reason is just
you
people
can
listening.
see the risk factors linked with health issues that are experienced globally:
So,
dietary
in terms
issues,
of
blood
innovating for
pressure,
sale, who are we really
tobacco
innovating
smoking,
for?
air
Is it the
pollution,
country of
unsafe
God's
sex.
200
These are
million
all the things
people?
that
Sorry,
affect
let me
your
say on that
businesses because
slide.
it has an impact on
98%
how
of people actually
eventually your
have
employees or you
less than
yourselves as the
500,000 naira in
entrepreneur
their
is
bank
able to
account. Sorry,
operate.
with 500
And
naira,
if we
but
look closely,
500,000 naira
6
in their
out
bank
of all
account.
these
So
risk
around less
factors
than
are
1,000
linked to
dollars in their
low
bank
quality
account.
diets.
And
Most of us
on
eat,
average,
sit and eat in the
60%
same spots.
of the
It's very
average
difficult for people to
Nigerian
take time
income
to stand
is
up
spent on
and
food.
move to a different
In some
environment to
regions
have
in
lunch.
Nigeria,
We don't
80
make
to
the time for
90%
it.
of
And
income is
sometimes
spent
you
on
eat
food.
the nearest thing that is
So
available.
if you're not in food,
I know people who work in the
then
bank. If
whatever
you check
businesses
their
that you're
desk
in is
drawer,
going to be
you
competing
have
with food, and
biscuits,
you need to think
a fizzy
about
drink,
what that
and
means
that's
for
it
your
for lunch
business.
for that day.
And if you look at
You find that
the
you come to
last
work in the morning till you
diagram
close
here,
in
you
the
can see that
evening. Some
there is
people
a
barely
Nigeria
go
where
through a
they're not
bottle of
even making
water.
enough to give themselves a proper
They don't eat
balanced
fruits,
meal.
no
And actually,
vegetables. Our
121%
dietary
of income.
diversity
So
score as a
they're not
country
actually able
is
to make enough income to give themselves
embarrassing.
a decent meal.
And this is even
And
more
this
strange because
is
we live
your
in an
market.
environment
This
that
is the
is
market that
blessed
you're
with
going to be
all these
operating in.
natural foods
So
and resources
it's not
that we
Silicon
need to
Valley,
stop, take
it's
time,
not
and take
London,
advantage of to
it's
help
not
our
even South
productivity.
Africa. And I think the more
Now, the
that we start
workplace
to
needs
look
to
at this
create an
market
enabling environment for
and
you
look at
to
the
operate
peculiarities of
optimally.
this market, the better
Work-life
we are going
balance
to be
is
able
very
to innovate
important.
for it.
Even as an
So
entrepreneur, you need to
the
find
next
time to
slide
take
shows
leave.
the
Employees of
numbers
certain
of
establishments find it very
billionaires
difficult
in
to take
Nigeria.
leave, either because one
And
person is saddled with so many
in 2025,
responsibilities. If
there are
that
about
person leaves the
60,000
workplace,
billionaires.
the
So just
operations are
in
crippled.
one city in
But you
India,
need to have
there are
that extra time to
65,000
step away.
billionaires.
Most
If
often, when
there
you
is
step
about
away from that
30,000
immediate
billionaires,
environment
in
and
comparison to
refresh your
11,000
mind, by
billionaires,
the time you
you
come
hardly
back, if
have
there were issues that had been plaguing
9,300
you, you
billionaires.
have a fresh
In Nigeria,
perspective.
there are
You're
about
able to
4,300
think
billionaires. So
innovatively
maybe
to be able to
12,000
find
people
solutions
with
to
a net
whatever the
income of
issues
about
were.
$1 billion. So
Now,
obviously,
because I work
time
in the
farmers
nutrition
market,
space,
if
I
you're
tend to
targeting that
focus
market,
more on
is actually quite
nutrition-related
small, even compared to countries like
factors
India
that can help
that we normally think about as the same market
productivity in the
size
work.
as us. Then when you look
58% of our
at
time in our work environments.
over half
So
of
this is where
Nigerians
we have
have
to
an
create the
advantage
time
reside in
to
Lagos
get
State.
access
And
to
this is
healthy
very important
foods.
for people
What are the
thinking
foods that are
about
available in
e-commerce
your
like
immediate
this, especially
surroundings?
where
Some people work in environments
strongly
where
reliant
you
on
have a
being
service
transacted
provider who
online and
comes in
paying
to
online.
provide
So it
canteen
means that a
services
lot
for maybe
of
your
people
staff
do
or
not
people
pay
who you're
online,
working
and this is
with.
something that we need
What
to
have
also
you
very
asked that
much
person to
understand. And I'll be
provide
providing
for the
solutions
people
to
in your
these
company
issues
or
at
for
the
the
end
people
of the
that are working with
presentation.
you? Do you
This
have
is
fruits
data
and vegetables
specifically from the
available?
Nigerian Bureau
How
of
often are they
Statistics.
consumed?
And
Do
to
you
put some
carry out
perspective,
nutrition education? You need to find ways to educate yourself on what is good for you. Nigerians on a whole have very poor health seeking behaviors. Whatever is wrong with us, the first thing we do is to Google it. If you are looking for cancer, Google will give it to you. We have very poor, we don't think that going to seek professional help is worth the amount of money that we pay for it. But in the long run, we pay even more because you try to use self-help methodologies to cater for whatever is you think is wrong with you, and in the end, when it turns out to be something a lot worse, you then go above and beyond to find solutions that you could have done in the early stages, which is where we talk about nutrition-focused health checks. It's important for you as an entrepreneur to ensure that whoever you're working with or that you yourself takes time to do your health checks. Sometimes people are moving about, you think that you're whole, but there might be something fundamentally wrong with you that is not, you're not symptomatic at that point. So it's not evident already until it gets to the critical stage. So annual checks are very important for us. Now I put breastfeeding here because as an organization, we work strictly with the SDGs. And part of achieving the optimal generation that we are raising is to support nursing mothers in the workplace and promote exclusive breastfeeding in the first 6 months of life. Now, we breastfeed in Nigeria, but exclusive breastfeeding is a big problem. Nigeria has exclusive breastfeeding rates of about 23%, as opposed to a country like Ghana that is just our neighbor, who are doing up to 60-70% exclusive breastfeeding. And let me tell you, people think breastfeeding is something that is just being propagated for the sake of it. But there is no infant formula that can give your child the nutrients that are in the breast milk. There has to be maternity support for working mothers. If we are saying that we want double income in households, the husband should bring something to the table, the wife should bring something to the table. She also has other responsibilities. She's raising children. Now, the husband needs to make time to support the woman to be able to breastfeed optimally. And the workplace also has to provide a conducive environment for her to start and sustain exclusive breastfeeding. Because sometimes when women return from maternity leave, the work environment does not allow you, there's no secluded area where you can continue to express milk. So what happens is that there's people stop breastfeeding really early. But if we create a conducive environment where women can go and express milk throughout the course of the day, because as you know, breast milk is supplied on demand. If the demand is not there, the supply is not there. And if the supply is not there, then in the very early days, the breast milk, the production will cut off completely. So supporting breastfeeding is very important in the workplace to ensure that the child who is in the house has milk that is fortified and nutrient dense for his growth potential, and that the mother doesn't have to keep calling in and saying, oh, she's taking the baby to the hospital, the child is not well, she needs to leave and go home early, because she has to also cater to the children at home. But breast milk is, if you notice, if you have nursed a child before, the moment you stop breastfeeding, that is when the child gets malaria. They say the child is teething, diarrhea comes into play. If you watch it closely, you will notice that that was when exclusive breastfeeding stopped. The immune system of the child is trying to adapt to its environment, and sometimes that happens too early, and it affects the overall development of the child. Now, also, focusing on this a little bit more, the first 1,000 days in a child's life is very critical, because brain development by the age of 2, whatever you have given to that child as far as nutrition is concerned, and however the child's brain has developed, that's the adults that you have to work with. So whatever you did not give the child by age 2, you rarely have any opportunity to provide those nutrients to that child. Sometimes you see children in the same class. They say this one is Olodo, these other ones are intelligent. What are the factors that affect the brain development of school-age children? Most of the time, breastfeeding is an underlying factor. Now, productivity in the workplace. I saw that image, healthy self, and I thought it was quite apt. Heal thyself. There's no one else who is going to do it for you, because you know yourself more than anyone else. In Nigeria, most often you start feeling symptoms, something is wrong, but you ignore it because you are chasing something else. You need to stop, take stock, and heal yourself. For a country, Nigeria, for every $1 invested in nutrition, the return on investment is $16. So tell me, is there any reason why we will not take our health seriously? We like numbers as businesses. So I put these numbers here to give you an idea of how health affects wealth in the workplace. We'll start with 25%. According to a Quantum Workplace report, employees who eat healthy are 25% more likely to have higher job performance. The same survey found that employees who exercise at least 30 minutes 3 times a week are 15% more likely to have higher job performance. Healthy employees take fewer sick days. That one is evident. Absenteeism is 27% lower for those workers who eat healthy and exercise regularly. Employees are 14% more engaged when provided with time off to recharge. It is important. There is no one who should be working 24/7. Even God took time to rest after creating the earth. So you need to give your employees an opportunity to take time off. I know people who work on Saturday and Sundays. I know bankers who used to go to the restroom to nap before going back to the work floor. Time to rest is extremely important. Now, 10% are more engaged when provided healthy foods in the workplace, healthy food options, even if it's not the employer that is paying for it. And 18% are more engaged when provided time for healthy activities, which is the reason why I say most often when you have a sedentary job, you're sitting in one spot throughout the course of the day. You need to make time to stand up from that place to go have lunch somewhere else. Exercise time is very critical. Just getting up and walking around your environment makes a whole world of difference. Now, the point is that once you add together medical spending, absenteeism, impaired performance, poor health, it's no longer just a human resource issue. It's a business challenge with major financial consequences. The way companies are managed affects this in a big way and increasingly damages how productive your workforce can be. Now, I can't have this kind of platform and not talking about the scaling up nutrition community. Now, like I said, I coordinate the Scaling Up Nutrition Business Network, or have coordinated the Scaling Up Nutrition Business Network in Nigeria for over 2 years. This is a community of businesses that have made commitments to improve nutrition outcomes, either for their customer base or for their workforce. It's a community where you get information about public health issues. It's a community where you get technical support for what you can do in the workplace that can promote health and well-being and optimal productivity for your workforce. The Scaling Up Nutrition Business Network has developed toolkits that small businesses can utilize if you're interested in workforce nutrition activities. We have also developed toolkits that help businesses in the food production space to reduce trans fats, which is an element that promotes non-communicable diseases in Nigeria. Now, there are a couple of things that businesses can do depending on the size of your business. There are activities that take place within the agricultural value chain that help to retain the nutrient integrity of the products that most of our businesses handle. We have activities around innovation and local solutions. And of course, workplace nutrition is there as well as one of the ways that businesses, private sector can contribute to reducing malnutrition in Nigeria. And I'm hoping that through our conversations, I will be able to engage more extensively with some of you in the room so that if you're interested, you can become part of this community. Thank you.